Welcome to the Research Works podcast, brought to you in association with the Healthy Strides Foundation. Your hosts are Dr. Dana Poole
and Dr. Ashley Thornton, and we're here at the AusACPDM conference in Cairns, Australia, to interview world-leading researchers, clinicians, and people with lived experience
to support your practice in being more evidence-based.
Welcome back, everyone. We are here at AusACPDM with Prue Morgan, who is a physio at Monash University and actually has been awarded a very prestigious title of Specialist Neurological Physiotherapist by the Australian College of Physiotherapists.
That's
Welcome,
right.
Prue.
Welcome.
Thank you.
Well, when we saw what the title of your paper was going to be presented today, we thought, well, we definitely have to chat with you. Very topical.
Absolutely.
So the title of it for everyone is National Disability Insurance Scheme. Alert, alert. As soon as you see that, everyone looks. An evaluation of plan size, access and use by people with cerebral palsy.
This sounds like a lot of work.
Yeah, but like you've mentioned, you know, it's intriguing.
It is.
The NDIS has been around for 10 years now. So,
oh gosh, really?
Yeah,
It's the
absolutely.
new thing. Yeah, it's been around for a
Absolutely.
while.
So why not have a good look, a bit of a deep dive into what's going on?
Absolutely, because it's kind of, you know, I think initially it kind of felt like a bit of a black box. No one really knew how things ended up where they did, but it's great that you were able to interrogate the data and unpack that a little bit specifically for people with CP.
Yeah, absolutely. And to be honest, it sort of grew out of quite a small sort of student project when we found that the data was released by the NDIS on a quarterly basis.
Yes.
And you could have a look at, you know, how many people with cerebral palsy were using NDIS or how many people with developmental delay.
Yes.
And so I'm thinking, hang on a minute, let's have a really good look at how people with cerebral palsy are using the NDIS funding across their lifespan.
Yeah.
And it's such an important question as well, because, yes, I've seen those quarterly reports and, you know, it's very transparent, shows a lot, but it can be a bit overwhelming to look at all the data as well. And, like, how do you interpret, is this a big quarter or a smaller quarter? Like, you need to look across it. And I often hear from families, you know, they will talk to each other a lot and go, well, how big was their plan? No one's really wanting to talk about what's in their plan necessarily, because that's very private information for them. But, you know, there's these, you know, what are you getting and how do I need to get more? Is what I'm getting fair? And what does that look like? So there's a lot of questions.
Absolutely.
Yeah.
And to be honest, unfortunately, we were only able to find out sort of average amounts. And so you know, similarly, I had, you know, families saying to me, oh, you know, we think our plan, our child's plan or our young adult's plan has been reduced in size, and others saying, oh, actually, we've been able to get quite a bit more. Yeah. And unfortunately, we've only got the average data, which obviously does sort of mask for every person who's had their plan decreased. There's obviously been someone who's had their plan increased.
Sure.
But, you know, it's what we've got. And we need to start somewhere. You know, why not start with what the NDIS has shown us and provided to us.
So let's talk a little bit about what you were looking for within the NDIS data and the time period that you were looking at that for.
Absolutely. So, you know, we drew a line in the sand and we said, well, let's have a look at the data that was reported for the quarter of March last year, just because, you know, that was when we started doing the study. We did do some comparisons for the for 2021 just to see, again, people had intimated that their plan had either been increased or decreased, and so we also wanted to have a bit of a look at that. But I guess, as you alluded to, you know, what is in people's plans? You know, what proportion is being allocated towards capacity building, or what proportion is being allocated towards sort of equipment and core supports, capital supports, and so that was what we were particularly interested in.
So you could tease some of that data out in terms of the different kinds of supports. I mean, for a lot of people who do listen that are from Australia, there are 3 different kinds of supports. But for those who are overseas and don't have NDIS terminology, do you mind just going through what each of those supports mean? You mentioned already core and capacity.
Yeah, absolutely. So core supports, you know, is sort of the essential day-to-day support. So it might be, for example, being able to fund a disability support worker to come into your home and help you get up, get dressed in the morning, get off to work or wherever you want to go. The next category is capital supports, and that's sort of essentially equipment.
Yeah.
So, a wheelchair or maybe a, ramp or bathroom modifications, those sorts of things.
Yeah.
And the final category is called capacity building supports. And those are, for me as a physiotherapist, I was particularly interested in what sort of goals are being identified by people, because essentially that's where that capacity building funding or payments sit.
Right.
And so, we were particularly interested in seeing, well, how much are people nominating a goal towards employment, or how much are people nominating they want to work towards a goal of lifelong learning?
Wow.
Yeah.
Oh, so you could tease a lot of that out.
Yeah.
Yes.
Yes.
It does. What did you find? What did you find?
Yeah, and again, perhaps not surprisingly, the biggest proportion in capacity building was devoted towards what we call daily activities.
Yeah. Sure.
So, developing skills in being more independent or as independent as you wish in terms of, being able to go shopping, or, being able to manage your finances, or being able to engage in a leisure activity.
Yeah.
I guess, my focus or my research interest is mainly around sort of young adults with cerebral palsy. And so, again, we were quite interested in, what sort of goals are they nominating?
Yeah.
And proportionally, how much funding is going towards things like employment preparation.
Yeah.
And again, perhaps not surprisingly, there was a big jump in the amount of funding that was allocated towards employment goals in that capacity building category for those sort of 19 to 24-year-old.
Yeah.
But interestingly, it sort of then dropped right off. And I would have thought, wow, does that either mean that they've already got employment, or does it mean maybe that it's just got too hard and so people are abandoning employment goals?
It's a really good question.
It is actually. And you can see where further research would be so helpful for this. That this has really uncovered those kind of things, isn't it?
Yeah.
And did the this might be a tricky question to answer off the top of your head, so apologies if that's the case, but how much did the proportions change across those categories depending on the age of the people that you were looking at?
Yeah, so interestingly, things like health and well-being goals remained fairly stable across the whole lifespan. Whereas, and again, perhaps not surprisingly, there was a big investment in those sort of daily activity goals, which I suspect is around sort of early intervention for younger children.
Sure. Yeah.
And then it sort of trickled off after sort of, adults. Didn't completely disappear, but it trickled off.
Yeah.
I guess what was a concern was that we found no allocation to lifelong learning. And again, if you think about, perhaps investing in a person's, capacity to develop skills in employment or being able to develop skills in, managing their own finances, you would think that there would be at least some funding dedicated towards that lifelong learning goal. So that we found curious.
Yeah, and there's a few stages along the NDIS process, isn't there? Like you apply for funding, but then that's reviewed, and sometimes the allocation isn't always what the person or the family has applied for. Is that right? So
yes. Oh, yes. It is. Oh, yes.
Yeah.
It is a really very complex process and very influenced by a large number of factors that may or may not have anything to do with the individual applying for the funding themselves.
Yeah, so I'm just wondering, maybe it's being applied for but not included in the plans, or maybe there's not awareness around the fact that that's something that you can apply for as part of your plan. I don't know, maybe there's
so many questions.
So many. And I often think about, when you hear about the journey that families have when they sit down to talk with someone about what their plan would look like, it really is so dependent on the person who is helping them to, really think about their plan, their skill set,
and their awareness.
And also the stages of life. And there's just so much to cover. We do this for a living, but I wouldn't say I know, I'm mostly pediatrics, so I wouldn't know the life stages for adults. But if I were to help someone to help come up with a plan, that's a whole lot of information to have to know and support someone with.
Yeah,
So,
absolutely.
Yeah,
and in fact, another part of our study, we looked at the influence of where a person lived on the size of their plan.
Interesting.
And again, you would possibly assume that, if you're perhaps a 25-year-old with, GMFCS level 3 cerebral palsy, that, your needs may be reasonably similar to someone else living in another part of Australia.
Yeah.
But in fact, there was a massive variability in the payment size dependent on where you lived. And again, some of it we can understand. For example, services in the Northern Territory, clearly they're going to be more expensive because they're not as readily accessible. You may need to travel. Or the therapist may need to travel much further to be able to provide that service. So some of that you can sort of understand, but some of it did not make sense to us. And so we suspect there are a lot of sort of a bit of a hidden agenda in some of those planned payment sizes that, as you alluded to, are not relating to the service itself, may not in fact be relating to the person themselves, but may in fact relate to the planner's knowledge and the planner's skills of how to use the system to maximise the benefits for a person who's applying for funding. So again, lots of really tricky things to tease out.
I feel like this particular work is a bit of a can of worms, isn't it? You've in asking the question, you've dragged up a lot of other questions, which is really great. And that's what we love about research, right? Is that questions lead to more questions.
Follow the trail.
Absolutely. And at the moment, there are a number of NDIS reviews underway, some of which are trying to unpick some of these issues, particularly around the where people live and how that might influence, because there's been concerns around the fact that possibly people who live in areas that are high socioeconomic, status, are highly educated, perhaps have got highly educated parents, that the size of their plan may in fact be bigger than someone who perhaps doesn't have that health literacy. And again, it shouldn't depend on the level of a person's health literacy.
That's not the intention of the system.
No. To wrap it up, what's the next step? Like there's a lot of next steps as we can see.
Which question to answer next?
Yeah. So what are you sort of embarking on next?
Yes. So absolutely. So this is obviously just interrogating the public facing data. And in fact, our next job is to see if we can get in behind that and have a bit more information around, some of those, we've only got the average data. What was the range? If there were people who were getting much less than the average, where were they living? What was some of the characteristics of that person? And so, in fact, with colleagues in CP Achieve, which is the research group that I work with, we're now sort of doing some more work on trying to unpick that using the sort of the raw data, if you like.
Wonderful.
So having access to that more detailed or unit record level data. Because the public facing data, it's great. It flags a lot of questions, but we can't answer everything with it.
Yeah. Oh, well, thank you for joining us today, Prue, and for, you've done well to condense all of that information into such a short podcast episode.
That was very impressive.
But, people can come along to your presentation later this afternoon.
Absolutely.
And, we look forward to talking to you again about the next phases of this work.
Yeah.
Okay.
Congratulations on the work. Thank you so much again. And to all of our listeners, hope you enjoyed that. We'll talk to you all again very soon. Bye.
Bye.
Thank you.